I'm Ashley Block. I'm a case manager here at GSHC Surrogacy Agency, and I'm here to talk about the gestational carrier process and timeline. So the stages for the journey. First, you will complete a medical screening, legal process, embryo transfer process, transfer day, pregnancy confirmation, OB care, delivery, and postpartum. So you just finished your intake process and had a wonderful match meeting with your intended parents. Now you are moving on to be introduced to your case manager. Your case manager will email you and reach out to you via text or call. And during that process, we do go over a few things, just kind of getting to know you, talk about our own experiences, anything about your job situation, your support system, period cycles, birth control. We also like to go over the whole entire process with you, what to expect and how you're going to travel there. Either be flight, driving, getting a hotel. We help out with all of that. We also like to talk about next steps after that. How long legal would take, you're going to be doing a transfer calendar, kind of what to expect during that time. We'd like to go over the entire journey with you. It's a lot of information, but we are here to help you every step of the way. During this medical screening, you have to travel to the intended parent's IVF clinic, wherever that is. So it could be California, Texas, any other state in the US. What's going to happen is the clinic will want to see you between days, depends on the clinic. So 6 to 10, 12 to 15. So we need to know the first day of a full flow of your period so that we can let the clinic know. So then they can now plan for a screening date for you. So if you are flying or driving, we need to know so we can help prepare those travel arrangements for you. We at the agency will be able to provide you with flights, a hotel, anything that you need for travel. So once you're there for your screening, you're going to be seen for an ultrasound, so a saline sonogram, which they'll go in. They're going to just look at your lining, see how thick it is. The reason why they want to see you so many days after a cycle is because they need to know how your lining looks naturally on so many days afterwards. They like to look at it, make sure that they can find the perfect placement for embryo transfer, and then they'll do some labs and take some urine to see if for any infectious diseases, do a drug test, and just to make sure that there's nothing that is going to stop you from having a healthy pregnancy. Medical screening results take up to 2 weeks, sometimes sooner, sometimes later, just depends on the lab. Once we have all those results, then we'll know if there is anything that is needing, such as a vaccine update. Do you need a vitamin D supplement? If there's anything that's going to stop you from moving forward that the clinic needs corrected, then we can do that before you're cleared. Now, sometimes everything's perfect and we just move forward. Before you can be cleared for medical screening, we also have to do a psychological and PAI assessment. During this time, us as case managers will reach out to a psychologist for you, and then they will reach out to you to set up that process. Now we say, please be honest and be truthful with them. Just talk to them. They want to know your history, and the reason why they have to know your family history is because they want to make sure that there is no trauma there for you moving forward that's going to stop you from having a good, healthy pregnancy, communication with your intended parents and such. So those are very important to do. You do need both good medical screening and a cleared psych PAI test in order to move forward to start the legal process. So legal process. During this time, you will be selecting an attorney, and here at GSHC, we can help you select an attorney. You have to have one in your state who specializes in surrogacy. Once you have your attorney picked and intended parents as well, we will send them all your information that they need, the compensation package you signed with us, IDs if you were employed, 2 to 3 recent pay stubs. They will draft up the contract. So IEP's attorney drafts up the contract, shares it with IEP's to review. Once they are done reviewing, it is now shared with your attorney, who then sets up a consultation with you. It's very important to read through your contract to make sure you understand anything that you are going to sign. If you do not understand it, ask questions. That's what your attorney is there for, you, to represent you. It's super important because you don't want to sign something and you don't understand it, and then later on you find out you signed it and didn't know what you were getting yourself into. Once you are done reviewing, have made any changes, those red lines are now sent back to your IEP's attorney, who then reviews it with your IEP. Now, the legal process can take, on average, about 4 weeks, sometimes longer, depending on all the changes made to the contract. Now, if there are no changes, can go by a little bit faster. Once everyone has agreed on the legal contract, now you will get the final to sign and notarize. Your attorney will walk you through how to do that. Now, your case manager also knows how to do it, so please don't hesitate to reach out if you have any questions about it. It is important to make sure you sign every single page. So once you have signed and notarized your contract, you will then mail that back to your attorney or IEP's attorney. Once they have you provided your contract and they can see that everything is signed and it's correct, they will provide a legal clearance letter to the clinic. One thing I highly recommend is not making any changes to your compensation package, because you already signed it in the beginning with us and your intended parents have already agreed to that. So if you go to your attorney and say, hey, I want to make a bunch of changes, I want to change my monthly or anything like that, it's not going to look good, because your IEPs are now going to be like, wait, why didn't you say something in the beginning and now all these changes are happening? It's going to take a lot longer. So just make sure you're not making crazy changes like that. Now, I can understand if in your contract intended parents came back and they said, hey, you can't have caffeine whatsoever. This is my example I use with everybody. You cannot have caffeine. But for me personally, as a surrogate, I have to have at least 1 cup of coffee in the morning. And there is a certain amount you're allowed to have every day while you're pregnant. So I probably come back and just be like, hey, I need at least 1 cup, or allow me to have a specific amount that is okay by my OB or physician, whoever is taking care of me. So something like that. And it doesn't hurt to kind of compromise. I know you said no to this, but how about this? And see what they say. It doesn't really hurt. So intended parents pay for all fees. Nothing comes out of the gestational carrier's pocket. Yes, it seems kind of odd, because you're like, hey, my attorney's supposed to be representing me, but my IEP is paying them. How do I know that they're not going to be biased because they're getting paid by the IEPs? That's not how it works. The IEPs put money into an escrow account that then we use to help pay for the attorney's fees, but your attorney is there to represent you and only you. They have your best interests at heart.